Nigerians, especially residents of Oyo State, have been warned to shun every form of stigmatization on people living with HIV and AIDS or any diseases around. The head of office, Apin Public Health Initiative, Dr. Folake Adurogbola, gave this warning at the 25th year anniversary of the NGO in Ibadan. She said there is a law in the state criminalizing any form of discrimination or stigmatization of any person living with HIV and AIDS, and anyone caught in the act of stigmatization will be prosecuted and face the full wrath of the law.
Stigmatization is a big issue, honestly, it's a big issue. And luckily for us in Oyo State, there's an anti-stigma law. If anybody is found stigmatizing an HIV positive individual, I can't remember, but I know that it will be taken up by the state, the legislatives, and then the person will be charged to courts, and I'm not even sure that they have a fine, but the person will be jailed, So we don't stigmatize anymore, and we tell people, if you are being stigmatized, speak up. There was one that happened recently. We took it up, and the case is still there. It's still being handled. So we encourage our people, both young and old, to know their status.
Speaking on the testing and treatment for HIV and AIDS, Dr. Adurogbola says knowing one's status is essential and everyone is encouraged to go for HIV tests. She says the testing and treatment of HIV and AIDS is absolutely free, and if one is infected with the virus, that is not the end of life for such person.
It starts by knowing your status, and that's by going for tests. The test is free. HIV test is free. It's when you know your status that you'll be able to seek for treatment. And gone are the days that when you are diagnosed of HIV, that is a death sentence. Now, anybody that is positive can live long, can live normal life. It depends on how you see it. And we always, pass the message across that HIV is not a death sentence, it's not the end of the world. There is treatment, and the treatment is free.
Stakeholders at the gathering took turns to eulogize the impact of Apin public health initiatives in Oyo State in the past 25 years.
On behalf of Oyo State Agency for the Control of AIDS, Oyo Saka, and the government of Oyo State, I congratulate Apin for 25 years of impactful service, education, commitment towards improving public health, and strengthening HIV and AIDS response in Nigeria.
All networks here that we should see the security of our children very, very important. But when all of us leave, they are the ones that are coming to lead.
I've done a lot, and I pray that this Trump fever will not water down all that you have done.
They have really grown over the years. They've helped many people to feel relevant in the society, not to feel that, okay, this is the end of life. They've helped them to come together as a group to support one another, to form groups whereby they even financially support one another. And they've had occasions of celebrating, their patients in our facilities. And they have trained some of our, healthcare workers to be able to, assist patients living with HIV and AIDS. And they've helped to remove that fear among our staff in the hospital.
25 years has been 25 years of consistency, keeping focus, health management strengthening, prevention of mother-to-child transmission, and some other ancillary they are involved with. I like to say that my first contact with Apin dates back to 2007 during my residency in obstetrics and gynae in usage. And under the leadership of the former health minister, Professor I.F. Adewale, Apin played a major role, and now working under Hospital Management Board as Director of Medical Service, I can say clearly that they've been supportive to general hospitals, and we have so many things they've done. Adeoyo Maternity in Ring Road and so many others.
Dr. Folake Adurogbola, however, appreciates the support of all stakeholders in the state, especially the Oyo State government, for the support given to the organization.